From UBN Studios, you're listening to Unsugarcoated with Alia, bringing you interviews with public figures and inspirational people speaking on self-improvement with empowering themes. And I'm your host, Alia Lanius. Hello, and welcome back to another episode of your favorite social good podcast. I am so happy to be here today, and I'm very excited to bring an amazing guest to your attention. I hope that you are ready for a conversation that has the power to transform the way that you think about healthcare. Today, we're diving into this topic that affects us, regardless of our profession. As you all know, we've been saying it all season long, emotional intelligence. We all know how important it is to connect with our doctors and healthcare providers, and emotional intelligence is a key component of that connection. By cultivating emotional intelligence, healthcare providers can better connect with their patients, foster a deeper understanding with their unique needs and experiences. This can lead to improved outcomes, greater patient satisfaction, and ultimately a more compassionate and equitable healthcare system for all. Our guest today is a leading expert on this topic and has the knowledge and experience to show us how we can all become more emotionally intelligent in our healthcare interactions, whether as patients, family members, or healthcare professionals. So get ready to be inspired as we explore the power of emotional intelligence and discover how it can revolutionize healthcare for the better, no matter your background or profession. So let's go. Let's bring on our guest. Dr. Pearl is a renowned advocate for healthcare reform and has led over 10,000 physicians and 38,000 staff in providing top-notch medical care for 10 million Kaiser Permanente members on the West and East Coasts. He is a clinical professor of plastic surgery at Stanford University School of Medicine and a faculty member at the Stanford Graduate School of Business, where he teaches courses on strategy and leadership. Dr. Pearl is the author of 2 highly acclaimed books, Mistreated and Uncaring, and hosts the popular podcasts Fixing Healthcare and Coronavirus, The Truth. He has been named one of modern healthcare's 50 most influential physician leaders and is a frequent keynote speaker at healthcare and medical technology conferences. We can't wait to learn more from him about this vision for transforming American healthcare. Ladies and gentlemen, please welcome Dr. Robert Pearl. Hello, Dr. Pearl. How are you today? Thank you so much for joining us.
My pleasure. It's great to be here and to be on your excellent show.
Thank you. Well, I know you're zooming in today because you are so busy traveling the world, speaking everywhere. Would you mind telling the audience where you're talking to us from today?
Well, today I'm speaking to you from New York, but yesterday I was in Las Vegas, and 2 days before that I was in San Diego. So as you say, this is conference season, and I have a chance to speak at a lot of events, but I was really looking forward to today, even though we have to be 3,000 miles apart.
Well, I feel that you are right here with me, and thank you for that. You know, for the audience, some people know, I'm similar to you. I love that my background has a lot of different phases and experiences that obviously contribute to who we are as individuals. And one of those little things 20 years ago was, or excuse me, actually more specifically 17 years ago. 17 years ago, I was working with the docket. I was actually one of the lead implementation advisors for what we call the docket, the Doctor's Office Quality Initiative through California, with the hope of leading other doctors into the new information technology era, right? And this was an exciting time. You and I briefly worked together, and since then you've continued to do amazing things. You were the CEO of Kaiser. And now, if people check out your LinkedIn, as I have, and get, subscribe to your newsletters, they find you are very passionate in your advocating for a greater, more emotionally intelligent healthcare system. Tell me how that started. You were practicing doing all these incredible things. Tell us about the journey to where you are today.
It's actually a fascinating journey in that I went to college, going way back when, to be a professor. And I was studying philosophy at the time. And my hero, a tremendous academic who ended up becoming the chairman at Reed College, but he didn't get tenure because of his political views. And I decided I wanted to go into something with no politics, and that was going to be healthcare. What did I know as a 17-year-old? It was remarkable how naive I was. But I think that same passion to make the world better, to have a purpose, to affect the lives of individuals, their health, their relationships, that drives me. As you say, I trained, I went to medical school at Yale, then I went to Stanford for my residency, and my passion was fixing children with cleft lip and cleft palate, which is the same thing, to see the smile on a parent's face after their child who has had this terrible deformity that would probably make it a social outcast, now looks normal and can have the same life as all the other children. But out of that, I came to a recognition that no matter how hard clinicians, doctors, and nurses work, and they work very hard, and how dedicated they are, there are major problems in the American healthcare system, ones that create distance between doctors and patients, between patients and nurses, ones that make psychological harm a constant factor in both healthcare for providers and for patients, ways that families suffer as a result of medical errors. In my first book, I talk about the death of my father from a medical error, from the economics. There are so many things wrong that I dedicated this, I'll call it the third part of my career after being the CEO in Kaiser Permanente, now to trying to improve American medicine for everyone.
That's an incredible story. Before we get into how emotional intelligence revolutionizes patient care in the healthcare system, I actually want to refer to an excerpt in your book. And I loved it because it really hit home, and especially because we are still moving through a pandemic in the different phases, as we all, we knew that there would be, and we're still in that, what I still consider a post phase, or still a phase of it. We still have people getting sick. But anyways, your excerpt says this: perhaps no system was hit harder than healthcare. Hospitals overflowed, equipment grew scarce, and the very foundation of American medicine crumbled beneath our feet. As we look back at this acutely difficult moment in medicine, it is easy to forget that the trouble had been brewing for some time. Independent research had by the early 2000s rated the U.S. healthcare system the most expensive and least effective in the developed world, a label that stands to this day. Dr. Pearl, how can emotional intelligence revolutionize patient care in the healthcare system, and what steps need to be taken to integrate it effectively?
The first part to me of emotional intelligence is being able to recognize and accept the truth. And that's hard to do. Mm-hmm. We tend to have a part of ourselves that we hide and others hide, and we tend to have a certain amount of distance, but the emotional intelligence to really understand another person, I think, is somewhat lacking. And so when I look at the healthcare system, we have to accept, as I noted in that quote, it's broken. In fact, the Commonwealth Fund came out with its newest evaluation. And once again, we were the most expensive, almost double every other nation. And yet our outcomes, and I'm talking about life expectancy, childhood mortality, maternal mortality, we were the worst amongst the 13 most industrialized nations. And so I think we have to accept that. At the same time, we have to accept the fact that the people providing the care, the doctors and the nurses, they're very dedicated. This is not the problem of they're not caring. This is a problem in the system.
Right.
And so when you have a system that I think is broken, but doesn't want to acknowledge that, you need to have this emotional intelligence, because what ends up happening is there's a distance. When there's I'll call it a lack of truth, a lack of authenticity, mm-hmm. then you end up with distance, and emotional intelligence suffers. You can't get close enough to that other person. You can't put your hands close enough into the problems that are there. Mm-hmm. So how does emotional intelligence apply? Well, the first thing is the doctor-patient relationship, because both the patient has to have the trust in the physician, and the physician has to be able to really understand the patient as an individual. And when that's all rushed and all you can do is feel like you're on a treadmill, what happens to emotional intelligence? It starts to disappear. Look at providers of care, and the COVID was a really great example. I talked to physicians who lost 4 patients in a day. Imagine what that's like. I mean, for a doctor, having a patient die, that's terrible. Right. 4 in one day is unbearable. And yet, how comfortable were physicians to talk about the pain and the suffering that they had as a result of their inability to save these lives? I think when you start looking about emotional intelligence, you start looking at the totality of people. And what we see, and we can talk about it some more, were disparities in care based upon race. We see social determinants of health having to do with socioeconomics, having to do with geographic factors leading to poor outcomes. You look at something like chronic diseases that account for 70% of the deaths in the United States today, and we do a poor job. And emotional intelligence would say we should be able to feel the pain of this other individual. And to a large extent, what I would say is that when it comes to the American healthcare system, I like to use the word, it's anesthetized. It's not feeling, it's feeling the individual pain, but it's not feeling the pain of everyone. Medicine, by its history, has had a lot of denial. It makes physicians heroes. I mean, how else do you take care of patients knowing that they have COVID early in the pandemic when we had no treatments, no immunizations that could protect the physician, when we ran out of equipment and doctors had to put garbage bags in place of gowns and salad lids in place of masks, and yet they kept giving that care.
Right.
And that's the heroic part. But the ways that we don't see the problems, that's where I think we need to magnify and elevate that emotional intelligence that you've been talking about on the show.
Oh, I love that. And I agree. I'm a 3-time cancer survivor, and I actually, as a result, live with several chronic illnesses, autoimmune diseases, fibromyalgia, POTS, just, to be fun, to make my life interesting, and I often have to share with people that, because they're like, well, how are you able to do all the things that you do? And it's because I advocate for myself in a healthcare system that at times can overlook me or say, oh, you're too, there was once upon a time I was too young for everything. Then it became I was too old for everything. Or now I'm getting old. So we're just kind of, reasoning off why I would be feeling that way instead of actually getting to the heart of the issue. How do you suggest patients in this day and age with I have to say, a lot of overwhelmed physicians and care providers, right? Like I recently had an encounter with one of my doctors and I had noted that it took 3 weeks for them to get back to me. And he just was like, well, my dad died and this and that. And it was a very interesting interaction because I wasn't used to a physician handling it that way. However, being emotionally intelligent, I just said, I hear you and I understand that you're overwhelmed as part of, everything that's happening, but I still need your care. How do you feel people who go into an encounter with a healthcare provider can themselves be more emotionally aware, advocate, but also still respect the process of what it means to deliver healthcare to individuals?
So the emotional intelligence makes me ask what's important to you. What are the things that you're worried about? What are the things that you think are very valuable? And understanding the ways that I can be a positive force in your life to magnify the good and to minimize the bad, and vice versa. And that's what I would say. I think that we've lost a lot of that in medicine because of the broken system that exists. But that doesn't mean as a patient, you have to just accept it. Emotional intelligence is not just taking all the bad, it's figuring out how you can have the interaction. So how might you approach it? Well, the first thing is to organize your thoughts before you see the physician. Why are you going there? What is the problem? How can you provide the information to make the other person's job easier? The physician's job is to help you get better. And how can you have all of that organized in a way that's going to work? But on the other hand, I also think that physicians need to recognize that you've got to listen to the patient. Yeah. And the data says that it's something like 20 seconds of the patient starting to talk. physicians interrupt the individual. And what's the message that's given? I don't really care that much what you have to say. I just have a job to do, boxes to check.
At the end of the day, healthcare professionals are heroes, but they're not Superman. They don't have X-ray vision. They're not psychic. So it's, there is a relationship and a transfer of information that can help really make it a better experience. So I love that you said that. Thank you so much. I am going to shift a little bit more to like the leadership and the aspect, balancing the need for high quality healthcare with cost effectiveness and accessibility can obviously be a difficult challenge that I'm sure you can speak to all day long. What innovative solutions and approaches can healthcare organizations use to navigate this challenge and provide the best care for their patients?
When I think about how do you improve care, I think about 3 P's. Number 1, there's process. How is that care delivered? There's product. What technology can be used to improve that care that's provided? And there's performance. How are the individuals in your organization doing all of those things? And they're all crucial. And emotional intelligence actually fits into all 3. A lot of the improvements when I was CEO in Kaiser Permanente that we did were changing process. I'll give you an example. You see a primary care physician for a problem, and that individual believes that he or she needs some specialty expertise. What usually happens? They tell you, go home and call the specialist office and make an appointment. That could be a week from now, 6 weeks from now. So what do we decide to do? We said the patient is not sleeping at night because they're worried. How do we solve the problem now? And we changed the process. So rather than just saying, go see a specialist, we brought the specialist into the room. Now we get to product using technology, using video. Because what we know in medicine is that somewhere between 80 and 90% of the diagnosis is actually made by the conversation, not by the physical examination. And so we can solve 50, 60, 70% of problems there and then. So that's the opportunity to understand the emotional intelligence through the patient. And what's interesting about it is that it improves not just the clinical outcomes, not just the patient's satisfaction, but it also actually lowers cost because the added visit is a wasted visit if the problem can be solved immediately at that particular time. When I was first selected CEO, I gave a talk up at the Oregon Health Sciences building. And I was walking the halls after my talk before I went to the airport. And I saw this sign. It said in big letters across the top, quality, service, cost. And in the bottom in small font, it said, pick any 2. And I think that idea is outdated. It's a 20th century notion. Today, we can give all 3, but we have to decide we're willing to make those changes. And that's where the leadership point you're coming up with really ties in, because people are afraid of change. People are worried that somehow it's not going to be very good. They're fearful that they'll never get home and see their family if they have to do all these new tasks. They don't understand why what they were doing before just wasn't good enough. And as a leader, you have to have an emotional intelligence to feel their pain, to feel their fear, and be able to respond to it, to explain why, to have them trust you. That this, maybe in the short run, will be a bit problematic because it always is learning a new skill. But once you do, it's really going to work. You and I were talking a little bit before the show about ChatGPT and the work you do at USC, teaching people in the film school about it and using it that's there. This is going to revolutionize medicine. But it is a computer application, but it's used by human beings. Mm-hmm. And so how do we understand the fear they're going to have? Doctors are going to be afraid they're going to lose their job. Patients are going to be afraid that some major mistake will get made. And how do we not dismiss the fear, but work with the fear? And the same thing around performance. My sense as a leader is that people are very motivated. They want to do the right job, but they want to do the right job for the right purpose. And that's the job that a leader has. What's the why of what we're doing? How does this really tie back into health? And in medicine today, I think we've lost that. I think we focus on not the economics, by which I mean the affordability to the patient. That's vital.
Right.
But we see it as a revenue creation approach. And we have to bring back the humanism. And part of that process is to improve the processes, to bring in the new technological products, and to help people to perform even better, because that's what they want to do.
What do you see something like ChatGPT being able to do? And with regards to the concerns of people saying, oh, it's going to take my job. I mean, in reality, there are things ChatGPT cannot do, right? So when it comes to healthcare, like, what do you think that it can do and what do you think it can't do?
What's out right now to me is just, it's like a toy computer that a kid uses as opposed to a big mainframe machine. This is just the beginning. And what we know in technology, Moore's law tells us that the power increases every 2 years. So by 10 years from now, it'll be 32 times more powerful than we have today. And by 20 years, 1,000 times more powerful. So no one should be thinking about what exists right now. It's just it's fun and it's a practice toy. And by the way, it's actually pretty good,
right,
compared to whatever else existed.
Right.
But it is nothing like what is coming. But I'll give you 3 ways that I think it will be different. And understand what the GPT stands for. It's a generative pre-trained transformer. What does that mean? Pre-training is it's loaded with all the information, everything on the internet, every textbook, every journal, every obscure diagnosis that's been made is in that system when it starts. Transformer means that it's going to have a series, by series, it's actually, I think, in the billions of instructions about how to answer questions related to that pre-training, to that information, and then it generates a response. So that's how the technology works. So as a patient, you have a lot of questions. You want to know what's going on. It's hard to get those answers. We mentioned before having chronic diseases. Chronic diseases, as you well know, affect you every day. That's why they're called chronic. Doctors in general see you every 3 to 4 months. What happens in between? ChatGPT can monitor that. If you have diabetes and a glucometer, can use that information. If you have high blood pressure and an electric cuff, you can use that information. There's all the tools that are there, and it can continually measure it, and it can update you as the patient every single day. You don't have to worry about what's going on. You can know what's going on. It can help you with lifestyle issues, diet, exercise. I think it will empower patients in ways they want to be empowered, but they're not yet today. And the third thing, and again, I suspect that in all the treatment you've received, you've been in hospitals. I know a lot of people say, if you're going to be admitted to a hospital, bring someone along to protect you. Medical errors. The New England Journal of Medicine said 1 in 4 hospitalized patients in the United States have a medical error. ChatGPT can prevent it. The way the methodology works is it predicts. The reason it can write all these essays is it's learned using these rules to predict the most appropriate next word. It does the same thing. What we know is when doctors and nurses do things, that there's a right way to do it, evidence-based, that's been shown to reduce the 200,000 medical errors every year that happen. And it actually can tell the clinician, you just skipped a step. I think it's going to totally change medicine. I think of it sort of like the iPhone. Who would have thought when the iPhone came out that it would be crucial for how you drive because it would tell you where to go?
Right.
Or it'd be the way that you find your lover of the future by going to one of the apps that are there, or it allows you to arrange your vacation. All the ways that we use that technology, to us, it was a mobile telephone, but it's not that at all. ChatGPT will be exactly the same.
And yet, all the things that it will do, it still won't replace, to be honest, the human care element, how we experience healthcare, right?
Absolutely. And this is where the emotional intelligence will never be replaced. I mean, computers will be able to mimic it. And that's what I'm sure you followed along all the debate in the media about this, whether it can actually have feelings and have a personality and fall in love with you. But let's skip all that, right? It can't do those things. It's a machine. And you need a human being to have that relationship I have a friend who told me a quote actually a few years ago that I just love. She said to me, when I pick a doctor, I want that individual to spend at least an hour with me. And then I never want to see that person again in person. I want to use telemedicine. I want to use technical tools. I want my healthcare to be managed. But in that hour, I got to build that trust. And as you said, the emotional intelligence is how do we understand the uniqueness of that individual? And that's what that hour is about. And so to me, the technology, the ChatGPT, will be the assistant to the physician. There'll be a lot of tasks that it does that doctors do today. But the primary relationship you have is going to be with another human being. It won't be with a software application.
That's incredible. And by the way, I'm smiling from ear to ear because I just love the way that you speak on this. You are so informative, you are so knowledgeable, and on top of it, I can feel your passion about it. I can feel the way that you want to help the world clearly, especially people overcome their fear and overcome these challenges. I mean, I do remember taking some nurses live with an electronic medical record system, for example. And I mean, they would cry. Some of them would break down in tears, Dr. Pro. I'm sure you've seen it because just that change. But, a week later, after they had developed an understanding, and then once they found their rhythm, they were fine. And then they would come back and say, oh, okay, I see how this is improving our process. I see how this is helping me get home on time to my kids for dinner, which is obviously, as you know, one of the other big complaints in healthcare is they put so much work, they sacrifice so much time, with their families to provide care. So I love that you say that. Obviously we have the AI and that component in technology. What trends do you anticipate in the next 5 to 10 years? And how do you think healthcare systems should position themselves to adapt and respond to these changes effectively?
I believe that the biggest change we're going to see is the movement away from fee-for-service to what I call capitation, which is paying a group of physicians and hospitals a set amount of dollars to provide the care. And as a consequence of that, it aligns the incentives with what you want as a patient. You don't want to have a heart attack. You want someone to help you prevent it. You want them there if you have the heart attack, but you don't want to have it in the first place. You want to make sure that they've done the things to keep you maximally safe. You'd like them to prevent the cancer before it happens. And then when it happens, you'd like them to diagnose it as quickly as possible. And you want them to do the procedure with the fewest complications. And that aligns the economic incentives. I teach in the Stanford Graduate School of Business and the medical school. And in the business school, we talk a lot about incentives. And in every other industry, we recognize how incentives and the context in which work is done changes perception and impacts behavior. And we just don't acknowledge it in medicine, but it's equally true. I think the biggest question is who's going to drive this process of change? I personally believe I'd like to see it driven by the clinicians, by the people inside the system, the doctors and the nurses. I'd like to see it driven by healthcare professionals who are expert and have that relationship with patients. Unfortunately, I'm not seeing that. I wish I were. I'm just not seeing the change happen. There's a guy named Peter Drucker who's a very famous leadership guru. And he said, to take on something new, you have to give up something old. And I'm not sure we're willing inside the healthcare system to give up the things that need to be given up to make the change to move from fee-for-service, which rewards volume, even when it doesn't add any value, to a capitated system. I think a lot of the change may come from the retail giants. And this is Amazon, CVS, Walmart. People who are listening and watching who maybe read the news in the medical world, the business world, have seen that these companies have taken on new additional companies that allow them to provide the totality of medical care. You had Amazon that bought a medical group called One Medical. You have CVS that purchased a medical group called Oak Street and another one called Signify. You have Walmart that signed a deal with United Health. And I think that these, and I'll call them consumer-focused companies, because when we order a product from Amazon, we have a wide choice. We have a good price. It's delivered on time. People who shop at Walmart will find a good product at the price they're able and willing to pay. So I think these organizations will be very consumer focused. The question is really going to be, is that what's going to be best for both the providers of the care and actually in the end for patients? And I think that still is to be determined. But as I look at the landscape shifting, I'm fearful actually that a lot of the control that I believe should and I would like to see come out of the system, come directly from the clinicians, is now going to be ceded to a different set of organizations who in the end, the values will be different. It still may deliver a better product. I'm not saying it's definitely going to be worse, but it's not as good as I believe that it possibly could be. That's what I see happening over the next 5 to 10 years.
You know, when you talk about the system being broken, when I owned my medical billing company and practice management, I handled a lot of the billing, and I'm familiar with the negotiations for contract for HMOs and PPOs and back in the EPOs and all the different things. And, from my perspective, you learn to see how a lot of healthcare providers overcharged. Billing was a very, a process in which I want to bill as high as I can because I know I'm going to get cut this much money, and I want to try and make what I can. But and I only say that because I feel like you said, the process has just been going amok for so long, and it's just been error after error building and not fixing it. And I genuinely would love for it to come to that point, which is I love that you encourage that type of, leadership and addressing these issues so that we could at least somewhere in this find a good starting place to rebuild it properly or to change it so that it can help everyone. As healthcare organizations, effectively address diversity, equity, and inclusion, both in their hiring practice and in delivering healthcare to services, how can they do that effectively, for their patients?
This is why I think the notion of purpose is so crucial. And I think purpose and emotional intelligence fit together because purpose gives you the right framework that then allows you to have that emotional intelligence to be able to be open, authentic, to be able to interact with people in a way that is open and honest, that sits there. Going back to what you just said about your experience, if you were going to try to recruit a doctor and you gave the physician two choices, I have two organizations here, you can join either one. The one over here, we're really going to teach you how to do a lot of things that are not necessary. We're going to teach you how to make a lot of money by taking care of people who are sick, but let them get sick in the first place so you can take care of them. We're going to teach you how to generate a lot of dollars. And over here you say, this organization, we're going to teach you how to keep people healthy, how to avoid heart attacks and strokes, how to have people have better relationships, less isolation, to be able to do more activities and to have a greater fulfilling life. And that's how you'll generate your money. Which do you think you can recruit to more easily? My experience is it's the second one. And the same thing I think is true when you talk about inclusion and issues with discrimination and bias. I think that as human beings, the negative feelings are ones that undermine us. They erode the purpose. And so I think if you start with the idea that says providing great care to everyone is what we're trying to do, not just to those who are wealthy or those who look like us or those who have a background like us or speak, whatever it's going to be, I think you start to motivate people in ways that just you can't do when money is the factor. In the business school I teach, I often tell people, incentives, monetary incentives, particularly big ones, always produce change, but rarely the change you want. What moves the change you want is to be able to talk about purpose, to connect with people, to touch them in some way. It's got to be authentic. They'll see right through you if you're making it all up. But that's what I see within the kinds of organizations you're describing. The reason they work is because the purpose is there. It's not a business imperative. It's not a legal requirement. It's just the right thing to do. And when you have that as the motivation, people experience it and they really want it. And they'll go the extra mile not because they're paid to do so, not because they're told to do so, not because it's in the policy manual, but because they know it's the right thing to do.
Aspiring healthcare leaders can learn so much from your experience. What advice do you have for developing emotional intelligence and leadership skills for themselves? Aside from taking your courses.
Yeah. Well, the first thing I think is you have to become comfortable with yourself. And I think a lot of people are not. You can do that by working at it. You can do that through therapy. You can do that through friends and relationships. There's a lot of ways you can get to it. But if you're not comfortable with who you are, you're not honest with who you are, you can't get emotional intelligence because you're always hiding. You're always protecting. And so that's what I think is, I'll call it the first step along the process. I think the second step is you have to have a genuine interest and a caring for the people you lead. And again, these are not things, you can try to fake them. And there's some people out there who are probably pretty good. They're a little bit sociopathic is how I would label them. I don't want to mention them by name or your show will get sued. But people probably can guess who some of them are. But I would say that it's that authenticity of individuals. And then you work at it. You work at it. You practice it. You have to be willing to take feedback. You have to be able to acknowledge when you don't know what to do. And you have to spend a lot of time. I used to spend, when I was the CEO, I spent very little time in the regional office. I spent most of my time out in medical centers, talking to doctors, talking to nurses, talking to patients, trying to be able to understand the world through their eyes. I think that emotional intelligence to me is this ability to simultaneously see the world through your eyes, but also see it through the eyes of others, to recognize that their view and your view are equally valuable, and that a lot of success, whether that success is business, relationships, friendships, teams, it doesn't matter where you look, is getting a cohesion between those two. And I'll go back again to this notion of purpose. Purpose becomes so important because you and I may have a lot of differences as individuals, but the chances of us sharing a common purpose, I think that's pretty high. And as I say, I think it's a magnet to attract other people. There'll always be people in a business, in an organization, who are only out for themselves. And the job of the leader is to find them and request that they leave. But 90%, 95% of people, they share a commonness, and being able to maximize that is how I think you have to do it. And you need to look for it. And as I say, I think it's a skill you can develop, and it's a skill you can get others to help you develop.
I love that. And, you know, we've only got a few more minutes with you. So I'll ask you this last question. As a thought leader in healthcare, how do you envision the future of healthcare, and what role do you see yourself playing in that?
One of my fears about the future of healthcare is that the default position is going to be what I'll label as a two-tier system of medicine. And we already have a two-tier system of medicine. The people who are poor don't get the same care as people who have the money. But I'm fearful that over time that's going to spread, because what we'll see is that those who don't have very much conceivably will drop lower and lower, whereas those people who can afford to buy what they want, to buy the health care that they need, will have the dollars to do so and not fall down along with those who can't. So that's my big fear. So my big hope is that we will find the ways. And that's why that is what I'm dedicated to. That's the purpose that I have right now. I can see the ways it could happen. I can see the waste that's in the current system, and that if we extracted that waste, you know, you mentioned in my book, Uncaring, how the culture of medicine kills doctors and patients. And by the way, if any of your listeners and viewers want more information, to go to my website, Robert Pearl, MD. But it was December 2019. COVID had not yet come to the United States. And the federal government announced or predicted that healthcare costs were going to go up 5.5% a year for the next decade. I did the math. You compound 5.5%, you apply it against the base at the time of $3.9 trillion. And it said that by 2030, our country would be spending $2.5 trillion more dollars than we were spending for the same healthcare that was giving poor results, at least at the national level. You know, I said to myself, wow, imagine we took $2.5 trillion and we prevented chronic disease. $2.5 trillion and we invested in taking care of the social determinants of health, or the racial disparities, or even preschool education for kindergarten kids. There are so many ways I could come up with to use that $2.5 trillion. And the healthcare system, no one spoke out and said that's inappropriate. This is the culture of medicine that says what we're doing today is the best that we can. And again, I'll say, I think the people are working as hard as they can, but the results that we're getting don't match either the dollars or the amount of work. And so it's changing all of that. It's why I do the writing. It's why I'm so privileged to be on your show. It's why I have my own podcast. I think changing all of that would make a massive difference, and letting medicine move from a sick care system to a true health system, not just a health care, but a health system. And if we can improve the health of people, that's their physical health, their mental health, their emotional health, I think that we would solve many of the problems that are plaguing our country today. That's my purpose. That's my vision. And I'm so glad that you're coming along on the journey with me, because I know you and I both want to land in the same place.
Agreed. And, thank you so much. I could not agree with you more. I am so grateful and thankful that we've reconnected after all these years, and that I get to be, an observer and a collaborator, because from the first thing I started reading when it came, I was like, oh my gosh, I love it. So thank you so much. I appreciate you. I appreciate your time, because I know you're so busy. But Dr. Pearl, I do look forward to getting you in LA one day. We're going to get you in the studio. Next time you're down here, you let me know, because honestly, I really do appreciate you and your time. Thank you so much for joining us today.
Thank you again. It's been a great time.
Thank you. And to our audience at home, what a thought-provoking and inspiring conversation we've had today. It is clear that emotional intelligence is a critical component of healthcare, and one that we should all strive to cultivate in our personal and professional lives. Dr. Pearl, thank you for sharing your knowledge and experiences with us and showing us the power of emotional intelligence in healthcare. Whether you're a healthcare provider, a patient, or just someone who cares deeply about the future of healthcare, the lessons we've learned today are powerful and actionable. By recognizing and managing our own emotions, we can create deeper connections with those around us, leading to better outcomes, greater satisfaction, and a more compassionate and equitable healthcare system. So let's commit to being more emotionally intelligent in our healthcare interactions, and let's continue to explore new ideas and perspectives that can transform the system itself for the better. Thank you so much for joining us today. Don't forget to check out our website as well, www.unsugarcoatedmedia.com. Sign up for this newsletter so you can stay connected and find out what's going on with us. We'll see you on the next episode. In the meantime, thanks for letting us be unsugarcoated. Take care.